7 to 35 hours is the average wait time for a psychiatric bed in the emergency room. And I know this because I have firsthand experience. I have bipolar disorder and I've been hospitalized many times. And as you can see from these pictures, how bare the rooms are, no windows, and you're not allowed any of your personal belongings, not your phone, and you're just expected to wait there patiently when you're in the worst state of mind possible. So that's where I came up with my solution. Serenity Station. It is a secure offline therapeutic tablet for mental health care. Being offline means we can have access to it because we're not allowed to be to the internet. And it is either you can just get the software itself, where the hospitals provide the tablets, or you can also buy the hardware feature, which is either the tablet secured to a wall, or a kiosk. And this is what it will look like. It has a 988 crisis hotline option where you can speak to crisis specialist or peer support. And I have a video and music library and video game where it's all offline and you get to go to different islands such as Zen Garden and Creative Studios. And there's even a what to expect app where you can know what's going on during your stay in the emergency room and what to expect when you transport it from the emergency room to the psych unit, and then what it's like once upon you get to the psych hospital, because a lot of the times patients have no idea and it's a very scary process. And here's the market opportunity. There's over 6,000 hospitals in America. That's Initial target is 10 to 15,000 devices, with the hardware revenue being 50 to 75 million potential, and the software is 18 million annual subscription with $100 a month fee. And how our expansion is going to work, our first pilot will be completely free to demonstrate value, and then our expansion is the consumer app, My Serenity, which is it has all the features that the offline station has, but there's more because it's online. This is an opportunity to have the post-care treatment you need and lower readmission cost. Competitive landscape, there's Leaps Health, Wobot, Wiza, Replica. None of them have offline functionalities. No 988 crisis lifeline interaction. Therapeutic gaming, they don't have. And the full care continuum coverage, limited. Ours has pre-care, inpatient, and outpatient. I will be discussing that in a minute. It's called Serenity Ecosystem. And then target setting is hospitals, ERs, rehab. There's no one else in that space. As mentioned, this is the Serenity ecosystem addressing all levels of care. There's pre-care, which is called the Serenity Insight, which is think of GoodRx meets Yelp, where people give reviews on their medication or the rehab or psych hospital they went with, using AI data analytics to summarize their feedback. Then there's the crisis prevention, which is Serenity Station, which I'm pitching about, the stabilization My Serenity app, which I also discussed, the post care, which is Serenity Speaks, which is a database of speakers who struggle with mental health. They go speak at hospitals and psych and rehab centers. Empowerment is my boredom relief program initiative, where I collect games, books, and other forms of entertainment to give to mental health patients. I've already collected 1,000 items, and there's an app that will eventually go along with it. And then the community component, which is called the Hidden Genius, where people from disadvantaged backgrounds provide solutions that they have faced. And that is your only qualification, because I truly believe that the people who have faced those issues are the ones to make that change. And so my call to action is hospital partners for 2026 pilots, 400K seed funding to build and launch. I need a team of software engineers and partnership leads and advisors in healthcare, AI, and policy. Let's build this together and change the mental health system. Thank you.